We have been sold down the river by our government in many ways in healthcare. And if you're not outraged, you're not paying attention. I was speaking just a couple days ago with the chief medical officer for a major international corporation. He was telling me how they are really struggling to manage their healthcare costs, especially in the area of specialty pharmaceuticals. A lot of these new medications that are so crazy expensive, medications that shouldn't be expensive, but someone has gotten a corner on the market based on how our government is mismanaging the non-system of healthcare today, and they can charge whatever they want. Our government has set rules on itself saying it can't negotiate on behalf of its citizens on pharmaceutical prices. The pharmaceutical companies can set whatever price they want, and we all have to pay it. This is insane. And if you're not outraged, start paying attention. Part of that problem is that because we're not often directly paying the bills, we don't have an impetus, a motivation to then speak up and say, this is insane, we want it changed now. And to keep the pressure and the heat on our elected representatives until they change it. But until we have a united voice and are able to speak and have presence and in effect lobbies, it's not likely to change. Let's fix that. Imagine a system where patients together hired and fired insurance companies, executives, pharmaceutical companies, hospital systems, provider networks, all of these mechanics. What if we hired and fired them? That's how a real market would work. What we currently have is not a marketplace. It's a monopoly system with Wall Street turf. We need to put patients, consumers, back in the driver's seat, where we determine what's valuable and what's not. And we determine how valuable it is. If it's really important for us to have something that currently costs $25 in this current system, then we need to move it up. If we have things that cost $5,000 and don't make a snit of difference, well, let's get rid of it. Or let's make sure it's only costing us $10.